India is gasping for breath. Our country is suffocating under a blanket of smog. We have some of the most polluted cities in the world. 13 Indian cities are in the top 20 most polluted globally. Delhi, our capital, holds the dismal title of the world's most polluted capital. This air pollution is not just an environmental issue, it's a public health emergency. Millions are breathing in a toxic cocktail of pollutants every day. This has led to a surge in respiratory illnesses, especially in cities like Delhi, Mumbai, and Kolkata. The situation is particularly alarming in Delhi. Recent data shows a significant rise in hospitalizations for respiratory problems. Asthma and COPD cases are on the rise. The latter half of 2024 saw a dramatic increase from 5 to 6% to 17 to 18% in hospital admissions. This is a clear indication that the air we breathe is making us sick. The health and well-being of millions of Indians are at stake. This crisis demands immediate attention and action. We need to clean up our air before it's too late. Air pollution is linked to heart disease, stroke, and lung cancer. Vulnerable groups like children and the elderly are the most affected. The economic burden of treating pollution-related diseases is enormous. It's time for stringent policies and collective action to combat this crisis. This public health emergency has a very real cost. Breathing polluted air doesn't just make us sick, it drains our wallets too. The financial burden of air pollution-related illnesses is immense. Families are struggling to cope with rising healthcare costs. Respiratory illnesses require expensive treatments, often long-term. Hospitalization, medication, and doctor's visits all add up. This puts a huge strain on household incomes. For many families, these expenses can be catastrophic. The situation is worse for those with pre-existing conditions. People with asthma, COPD, and heart disease are more vulnerable to air pollution's effects. They need more frequent medical attention, increasing their healthcare expenses. This financial burden is pushing many families into poverty. The cost of breathing clean air is becoming a luxury many Indians cannot afford. The economic impact extends beyond healthcare, affecting productivity and livelihoods. Sick days and reduced work capacity lead to lost income and opportunities. The cycle of illness and financial strain is hard to break, trapping many in poverty. The health insurance industry is feeling the pressure of this public health crisis. Insurers are seeing a surge in claims related to respiratory illnesses. This is particularly true in highly polluted cities like Delhi. To mitigate their losses, insurance companies are considering drastic measures. There are talks of hiking health insurance premiums. Some insurers are proposing increases of up to 10 to 15% in polluted cities. This is a direct response to the rising number and cost of pollution-related claims. Some insurance companies are exploring new strategies for calculating premiums. They are considering incorporating air pollution as a factor. This means people living in more polluted areas might have to pay higher premiums. These proposed changes have sparked debate and concern. While insurers are responding to a real financial challenge, these hikes could make health insurance unaffordable for many. This is especially worrying for vulnerable populations, the elderly, children, and those with lower incomes. The insurance industry is also looking at innovative solutions to address the crisis. Telehealth services are being expanded to reduce the burden on hospitals. Insurers are also offering more comprehensive coverage for pollution-related health issues. These efforts aim to provide better support for those affected by air pollution. The crisis of air pollution and its impact on health insurance premiums has far-reaching implications. It highlights the urgent need for a multi-pronged approach to tackle this challenge. Firstly, the government must implement stricter measures to curb air pollution. This includes transitioning to cleaner energy sources, promoting public transport, and penalizing polluters. Secondly, the insurance industry needs to find innovative solutions that balance their financial stability with the needs of their customers. This could involve developing affordable insurance products for vulnerable populations, or offering discounts for individuals who actively contribute to reducing their carbon footprint. Finally, creating awareness about the health impacts of air pollution is crucial. Educating the public about the importance of air quality and encouraging individual actions to reduce pollution is vital. The crisis we face is a wake-up call for India. It is time for collective action to clear the air and secure a healthier future for all. The government has already started initiatives like stricter emission norms and expanding green cover. Communities are coming together to create urban gardens and green spaces. Activists and citizens are raising their voices for cleaner air policies. Together, we can make a difference and breathe easier.